known and renowned, but I wish I share with you for some 5-7 minutes of his profile as we await more people to join. So I will share a short presentation as a matter of introduction. Am I slide seen?
Yes.
So I would like to introduce to you, to reintroduce actually, Dr. L.Prakash to some surgeons who are new, who didn't know him before, although some of us know him for almost 8 years now. And we are lucky to have been learning from him. He's been inspiration to most of us, especially in East Africa. I thought we should mention this. So Dr. L.Prakash will be the faculty today, and is the Director and Chief of Orthopaedics in Kerala, Institute of Special Orthopaedics. He's a celebrated teacher and a guru in orthopedics and trauma with over 38 years of experience. So he's well known worldwide. And we in East Africa happen to know him back in 2015 from social media and other internet forums. He's been spending most of his lifetime in teaching orthopedics, decades of orthopedic teaching, back from 1985 to early 2000s. It was 2015 as well. So he spent most of his time as a teacher in orthopedics, despite being a surgeon. He has conducted over 120 workshops in Elizarov and Arthroplasty workshops as well, worldwide. So he's basically a senior consultant, revision arthroplast and Elizarov surgeon.
The webinar, later.
Who spent his early years of experience in London, Oxford, Wrightington, in Basel, Bain, and Davos during his training. So as I said, he was the director and chief of Institute of Special Orthopaedics in Chennai from 1988 and moved to Parkard in Kerala about 3 years ago. He's the current president of the Indian Academy of Orthopedic Surgeons. He was also the past vice president of the Indian Orthopedic Association, and was also once the past secretary of the IOA. He is a polymath and scientist, a combination which gives or makes him a prolific teacher and a brilliant surgeon. Polymath in terms of being an artist, an engineer, a designer, an author, a writer. So a combination of being a polymath and scientist really makes him a prolific teacher and a brilliant surgeon. He's a brilliant and well-articulated author of 1,000 articles and publications with 23 orthopedic textbooks. You see, the first atlas of primary hip arthroplasty was written back in 1991. And the next year, in 1992, the total knee replacement guide was written again by him. And this is the new version of the atlas of the hip arthroplasty in 2019. So he's an author of about 23 plus orthopedic textbooks, plus non-orthopedic textbooks, making a total of about 200 textbooks. So you can note the volumes of the books: the Beginner's Guide, Total Knee Replacement, Atlas of Surgical Exposures. So they're not 100 pages or 200 pages. They're big books, 600 plus pages. You see, we know in this part of the world, in Africa and East Africa, we struggle in writing. We write very literal. We read very literal. They're going to see the volume of books he's written so far, about 200 books of them. So the Magic of Elizarov, and these are the current books, like the Biological Method of Fracture Management, which he wrote along with Professor Augusto Samianto, who unfortunately passed away in January this year, I think. So he's also known as the man, the Renaissance man, in terms of he tries to bring the forgotten arts of orthopedic principles, like the conservative management. You know, there's that saying, we use it very frequently in our TOA meetings and forum as keep two ends of a fractured humerus in a room. They will unite unless an orthopedic surgeon enters the room. It comes from him. So biological method of fracture management, a textbook has been written. But again, physiological portals, none orthopedic textbooks, 150 plus. Seeing is not believing, among others. For those who love novels, you can get lots of novels from Dr. Prakash. You can see he's really a prolific writer and author. So the IOA recognized his contribution in academics in 2021 and makes him an outstanding teacher and surgeon as well. He's an inventor and designer of what is regarded as these Prakash universal hip knee system, which are relatively cost-effective as compared to other models. We know there are a variety of hip and knee prostheses out there, but these are Indian-based and they're relatively cheaper. And the survivorship is comparable to what are regarded as standard prostheses, such as the case of the Madras knee. The survivorship has been documented to be 89% survivorship in 20 years. So this total knee system, the Madras knee, designed by him. And you can see this is the part of the section of the factory where the Madras knees are produced. He's an inventor and designer again of ultralight Elizarov rings, which makes Elizarov surgery quite friendly and patient friendly as well, as opposed to the early Elizarov rings, which were really heavy to the patients, making them uncomfortable to the patients and to the surgeon as well. He's an inventor of many surgical techniques, including proximal fibular osteotomy, which is a method for treatment of isolated medial compartment, also arthritis of the knee. So, Sir Prakash, we have these, most surgeons in East Africa have these textbooks, well, because we have started doing proximal fibular osteotomy in isolated medial compartment osteoarthritis, instead of doing unicompartmental UKA arthroplasty. This is another option. But again, a shoulder reduction technique of a dislocated shoulder where you don't need anesthesia, you don't need an assistant, you don't need to do traction. A sustained external rotation for 2 to 3 minutes will reduce a dislocated shoulder. And I've personally used the method and I've reduced close to 20 patients with a dislocated shoulder with success, which some of them were neglected up to 2 months, neglected shoulder dislocations. I still reduce them. So this is published. There are many publications on Prakash method of reduction technique of a dislocated shoulder, but I also personally have the experience of about 20 patients whom I've reduced with this reduction technique. He's an artist and a medical illustrator, as I say, he's a polymath, a painter, a sculptor. So the textbook says written, he doesn't employ an illustrator himself who write the books and he will illustrate himself, which makes him really perfect writer. He's a sculptor, you can see. He made bone cement self-sculpture of himself. And these are all sculptured like from his works. He's been inspirational to many surgeons worldwide. You can see through the conferences, as I said, 120 plus conferences he organized in Israel and Arthroplus. But I also met him in person in 2018 back in the northern India, in Jaipur, Rajasthan, for the first time when I met him in one of the conferences he had organized, which was themed unusual orthopedics or orthopedics beyond books and journals. So I was interested. Let me go and see what is happening. Although I knew some ABCs of what the conference actually had based on external fixation, but again, the conservative measures and the hip preservation module as well, where I also happened to meet Professor Narendra Kumar Magu, whom we know also who visited Tanzania. So he has since then been known as the Da Vinci of Indian orthopedics, and we are really proud and humbled to have him as our faculty today, although we know he has also been very instrumental in organizing these webinars, and we will thank him. And I welcome him to proceed with his talk on Elizarov surgery. Welcome, Dr. Prakash.
Thank you very much.